Hello, how you doing? I'm Dr. Matt Young. I'm your 2025 AAID President. Today we're going to be talking about our annual meeting coming up in Phoenix, Arizona, November 12th to 15th. We're going to have an awesome main podium. We're going to have a great hands-on program if you want to increase your skills hands-on technically. We're going to have social events, networking events, and we're also going to have our credentialed members coming through. So it's going to be a great time to celebrate with your friends and colleagues. If you haven't been to a meeting before, come to this meeting. It's with great pleasure today that I'm able to interview Dr. Ramsey Amin. He's going to be our main podium speaker on Friday morning. Dr. Amin is very accomplished. He's a diplomat in the American Board of Oral Implantology, a fellow of the American Academy of Implant Dentistry. He's a teacher among teachers, a leader among leaders. You know, a lot of us go to him for advice and support and for new techniques and procedures. He runs the very successful dental collaboration of Dental Implant Exchange on Facebook, where people can come together and share ideas, and it really develops a whole network around the world. So we're very happy to have my friend
Hey,
Dr. Amin with us today. How are you doing?
hey, good, good. Thanks for having me here. This is awesome. It's another good day.
It is another good day, and
Yeah,
you're down in Burbank, California, and I
yeah.
know you
Southern
guys
California.
have, yeah, nice sunny weather down there. So we're happy to have you join us. You know, you are extremely accomplished. You place
Mm,
thousands of endosseous implants. You place zygomatic implants,
mm,
pterygoid implants, nasal
mm.
implants,
Yep.
sinus lifts, bone grafting. We've all learned so much from you. Your presentation this year is on subperiosteal implants, which is
Yeah.
one of our earlier modalities for implant dentistry. I'm on the 75th anniversary committee for AAID, and we were down at headquarters a couple of weeks ago, and we have published work from Gershkoff and Goldberg, two of our first presidents, on subperiosteal implants in 1949.
Wow.
Widely popular for an era, and it seemed like they kind of fell out of a treatment modality for a long time. So why are you lecturing on subperiosteal implants when you have so many different options that you can use?
Yeah. That's a great question, right? Don't trends come back into style
There you
sometimes?
go.
So it's certainly not a style that I'm doing subperiosteals. Obviously, when there is no other solution, subperiosteals kind of fell out of favor for many years because of difficulty in fabrication. Obviously, with the advent of just root form implants, there was kind of not a lot of reason to use them except for special cases. And then it became something that like kind of a lost art. And what's happened over the last, several years with technology changing, especially in the CAD CAM world, being able to mill these things or perhaps print subperiosteals for these cases that couldn't be done before, right? So what we're seeing, as you know, Matt, this kind of onslaught of we wish all of our work was permanent and that it never failed, but we're seeing some mandibles that were treated with endosseous implants that may have had complete failure and they've lost so much bone there's nothing that can be done, or the patient has medical concerns that maybe integration on a root form just doesn't work. They've gone through multiple rounds of regular implants, and maybe it's putting something on top of the bone rather than into the bone can be more beneficial, more streamlined, kind of going back to our roots, but with a more refined technique of doing it nowadays instead of taking an impression like our forefathers all called them. We're doing it all digitally, right, through virtual impressioning and virtual scans for CBCT, and only opening up the patient one time for one surgery. So it's really you're going to see. It's going to be an awesome lecture. I'm excited for it. It's kind of unlike any other, but it's going to be something
Yeah.
that we're all going to need to know how to do. And I think the guys before us that have either passed on or are retired, it's a dying modality. So it's going to take some of us to bring it back because it really can bring some tremendous benefits to some patients that really need it. They're crippled by their oral system. They have no ability. They have no life sometimes. So it really brings back a lot.
Yeah, you really hit the nail on the head there with patients are dental cripples without the ability to
Mhm.
chew and
Yeah.
eat, without lower teeth. It's just very, very difficult for them to have proper
Right.
food digestion,
Yep.
proper life. And, we see that, but, like you said, they've had implants placed maybe in the past, and maybe
Hmm.
they've been on chemotherapeutic drugs or
Yeah,
bisphosphonate drugs. And the
correct.
risk of some implants are pretty severe, aren't they? When
Yeah, yeah,
placing more implants on a patient who's older with implants that have failed, the risks you take on from that are not acceptable.
correct. Yeah, and sometimes the subperiosteal can be less risky. And of course, we're going to cover maxillary versus mandibular subs and whether they should be placed in the maxilla at all. There's some different designs, and then there's a lot of just things all over social media that you see things that look like subperiosteals that really aren't, and they're just kind of like bone plates, which aren't subperiosteals. The design is everything as for how this is going to, work out long term, or does it just become, another failure? So this is things we really need to bring to, to our colleagues for better understanding of, what we can do, and not just follow fads and see something on Instagram and then replicate it in your 3D printer and then put it in somebody's mouth, because that doesn't work that way.
Well, I'm really
Mm.
looking forward to this
Yeah.
lecture. We want to be able to offer our patients the cutting edge technology, and to offer cutting edge technology for a procedure that's been done for years, but now, with CAD CAM, with planning, with advanced sciences, with your
Yes.
techniques,
Reinventing. Yeah. Yeah.
reinventing the subperiosteal. I love it. It's going to help our patients. I know our docs are going to love it, and it's going to be on the main podium. So Friday
Oh,
morning, be able to see you on the main podium. It's going to be awesome. Yeah,
yes. I'll be sure to show a lot of different examples of when
good.
and how, and different cases, and things that we've done with designs that could be improved as well. As I've seen some of these cases age, just like our regular implants. How are we going to manage the complications of subperiosteals, because they exist as well.
Yeah.
Yeah, but it's better than a denture, that's for sure. Better
Oh
than a
yeah.
lower denture on somebody that has no ridge and no ability to chew or even just look normal, right?
Oh, it's going to be great. I
Yeah.
can't wait for it.
Hey.
And you have a great outreach. You lecture all over the world. You really connect with a lot of people, and you're in high demand. Why do you keep coming back to AAID? Why do you refer other people to AAID? And what's the allure for you?
Well, the idea is hands down the best dental implant organization. Everybody has a common goal, rather than having a lot of, like, let's say, cutthroat competition. There's much more collaboration and friendships that are developed. I mean, you and I have known each other for 20 plus years,
Yeah.
and we've helped each other out on different cases as well. You don't find that in other groups, for sure. They still haven't learned to collaborate in such a way that elevates implant dentistry as a whole, not just for necessarily one patient, where people are keeping their secrets. Really, in this day and age of information, sharing that information and doing it in a platform, at the AID national meeting. There's nothing that replaces it. The in-person learning, the camaraderie, just the discussions that you have on the side. Sitting next to your colleague, or in the elevator, or at the bar, or in the restaurant. And those are things where they really happen. We hear these lectures, we take part in these workshops, but there's a lot more to it that happens. So getting off our butts and actually getting on a plane and traveling, it's very meaningful.
Mhm.
We've all become a little more lazy after COVID, but I think it's really, in-person learning is just so important. There's way more to it than just listening to somebody and then writing down a 6-digit code for your
Yeah.
CE.
Yeah, we've talked about that. We learn just as much or more by talking to people during lunch, at the social
Yeah,
events, afterwards. And those are people you can, connect with and talk to
correct. Yeah,
afterwards and say, we talked about this at the meeting, but
mm,
now I have a case, I'm planning it. And those are the people you
yeah.
connect with. That's how I've learned
That's
most over the
yeah.
years.
That's how it happens.
Yeah. Well, we're really excited to have you at the annual meeting,
I'm
and
excited. Yeah.
yeah, so you guys can everybody register today for our AAID annual meeting, November 12th to 15th. You can see Dr. Amin and many of our speakers on the main podium, hands-on workshops, camaraderie. See our record new amount of credentialed members coming through on Saturday, so it'll be an awesome time. Thank you very
Okay.
much.
See you guys. Take care.